Hello, my name is Vanessa Magallanes, and I'm a freshman student at the University of Michigan School of Nursing. Today I will be giving a patient report. Patient is a Caucasian, 40-year-old married female. Her present occupation is working as a cosmetologist, which she has been doing for 20 years. Patient's blood pressure is typically around 140/90, heart rate 62, respiratory rate 15, temperature 98.8 degrees Fahrenheit. Patient's chief complaint is constant and painful discomfort in lower abdomen. Onset of reported abdominal pain was 6 months ago. Patient reports the painful episodes beginning following a gastric bypass surgery. Patient describes the attacks as excruciating and rates the pain as a 9 out of 10. Pain is located in lower abdominal area and at its worst is sharp shooting pains and at its best is constant dull throbbing pain. Alongside of the pain, the patient also frequently experiences irregular bowel movements, including bouts of diarrhea followed by constipation. Intense pain can last anywhere from 3 to 5 days. Patient reports pain occurring frequently, typically following certain foods. Aggravating factors includes eating certain foods with gluten. Alleviating factors include little to no movement while resting. Patient reports pain causing the inability to accomplish her daily living activities. Patient believes a wheat allergy might be the source of the problem. Health history. Patient diagnosed with cervical cancer at age 19. However, no problems have occurred since treatment. Patient suffered from depression in early 20s. Diagnosed with asthma at age 17. Patient is up to date on all immunizations, has no known allergies or reaction to drugs. Hospitalizations and surgeries include hernia surgery 3 years ago, gastric bypass surgery 6 months ago, varicose vein laser therapy 1 month ago, following the occurrence of thrombosis in lower extremity. Patient is currently on no prescription medication and takes only daily vitamin supplements. Functional assessment. Patient reports not being engaged in drugs, is a non-smoker, and drinks little to no alcohol. Patient exercises 3 to 4 times a week, walking on a treadmill. Patient gets adequate amount of sleep each night except for when suffering from abdominal pain. She receives proper nutrition, drinks 2 cups of coffee each morning. Patient reports being happily married for 13 years. She has 2 children and claims to have a very calm home life. She identifies as being Roman Catholic but does not practice regularly. Biggest stress factor includes her daughter being away from home at college. Family history. Paternal side, unknown. Maternal side, history of breast cancer, COPD, diabetes, and hypertension. Gastrointestinal system was reviewed. Patient denies experiencing heartburn. However, reports constant feelings of indigestion. Also reports constant change in bowel movements, changing from diarrhea to constipation for a few days at a time. Bowel movements tend to be very painful, no longer able to tolerate foods containing wheat. Denies experiencing symptoms of jaundice. Pain influences change in appetite. Patient suffers from nausea but denies frequent vomiting. Peripheral vascular system reviewed. Patient reports pain in legs and calves within an hour of walking or sitting in chairs. History of both edema and hair loss on lower extremities. Also history of blood clot in lower extremities. Varicose veins present. Onset early 20s. Does not report pain in hips or thighs. Peripheral vascular system examination. Patient's lower extremities were inspected. Normal color was observed. Viscosities present. Diminished hair distribution. No presence of edema. No presence of ulcers. Temporal pulse, carotid pulse, brachial pulse, femoral pulse, 3+. Popliteal pulse, dorsalis pulse, posterior tibial pulse, 2+. Tenderness of lower extremities reported. No edema or abnormal warmth present. Normal capillary refill response. Abdomen assessment. Patient's abdomen was inspected. Normal color, contour, umbilicus. Normal symmetry. No bulging or masses observed. Lesions and scars from previous surgeries present. All abdominal quadrants auscultated, vascular sounds present and normal, bowel sounds present however higher than normal frequency. All abdominal quadrants palpated, both light and deep palpation caused pain for patient in lower abdominal quadrants. Aortic pulsations present. Negative results for ileostosis test, negative results for arbitrator test, negative results for Blumberg sign. Pertinent system number 1, respiratory system. Patient was diagnosed with asthma at age 17 and also has a family history of COPD. According to the article Overlap Between Asthma and COPD, where the 2 diseases converge, posted in Allergy, Asthma, and Immunology Research Journal, asthma and COPD both lead to accelerated decline in lung function. Worsening severity of asthma can permanently damage lung volume, causing results similar to that of smoking for years, more easily leading to symptoms of COPD. For this reason, it is important to consistently check the health of patients' lungs, observing any diminished function. Pertinent system number 2, integumentary system. According to a varicose veins article for nurse practitioners, it is important to assess the integumentary system as well because of the patient's presence of varicose veins. Varicose veins make it difficult for blood to travel back up to the heart, which causes problems for the lower extremities such as ulcers and edema. For this reason, the patient's integumentary system must also be monitored.